Hello and welcome to the A4M Practice Implementation Series podcast sponsored by both A4M and Ovation Lab. I'm Tom Blue, a founding partner with Ovation Lab. I am delighted to be joined today by two friends and colleagues. One is a longtime colleague, Sonia Horner, an original pioneer in the world of concierge medicine. We've had a long history of setting up practices together, and she is a brilliant practice operator and patient experience designer. But the real star of our show is Dr. Don Brown, the founder of Bioscope.ai, which is a technology company that I had the wonderful good fortune of stumbling upon, and have now gotten acquainted with Don. He is a wildly successful physician, entrepreneur, and philanthropist. Previously the founder of a company called LifeOmic, and has put together a tool that I think we're going to have a wonderful time talking about. In today's opening session, actually, one of the things that I had mentioned was that in 2026, as practices need to begin to differentiate their AI capabilities from patients, one advantage that is likely to emerge is the ability of a practice to have an enormous sort of window of context around a patient. And I think we're going to hear probably the most compelling example of that to date. So, Don, I was hoping that we could kind of get kicked off with a little bit of a story from you, how you moved from your work in LifeOmic and into now the land of Bioscope, which is being unveiled here at the Longevity Fest for the very first time.
Some early work in trying to build an AWS-based cloud repository for patients where we could aggregate all health-related information, primarily for cancer patients. So starting with their electronic medical records, but also their germline, the genome sequences they inherited from mom and dad, and then their somatic DNA sequences, the sequences of the cancer. And then using software tools to analyze the differences and ultimately try to identify the driving mutations. That was pretty rewarding. I put together a world-class team. It was used at Indiana University Health for some of their most difficult cancer cases. But in 2023, Fountain Life came along and bought that company as their data architecture. And I really expected to stay retired. I live in beautiful Park City, Utah. I love to knock around in the mountains, rock climbing and mountaineering with my 8 kids. But earlier this year, I was approached by a group about buying and relaunching 23andMe. And just as a courtesy, I examined that, quickly realized I'm more of a startup guy than a turnaround person. But I learned 2 things that set me off. One was that the cost of whole genome sequencing had taken a major drop from about $1,000 to $300. Which opens up a range of possibilities because outside of the context of cancer, you only have to do that once in your life. And then secondly, I took the occasion to do a deep dive into the state of medical AI. And I was blown away. And it really recalled a remark I'd made. I'd given the commencement address to my med school alma mater, the Indiana University School of Medicine, back in 2017. And I had predicted that before too long, these young graduates would be working with an artificially intelligent colleague. And it just hit me that it was now possible to build something like that. And by God, I wanted to be the one to build it. And so I told my kids, I said, I just can't sit this one out. one of the benefits of having a long, relatively successful career is that you develop a good personal network. I put out some vague signals on LinkedIn, and I had wonderful people covering all of the bases from cloud architectures to security to bioinformatics and so on. Respond and say, if you're serious about doing this, I will take a cut in pay to join you. Lo and behold, here we are. 6 months later, I'm still in a little bit of state of shock as to how quickly it's come together. But we have about a team of about 30. And we've built what I think is a pretty revolutionary approach to primary care medicine.
Well, let's dive into the revolutionary approach, because it really is different from kind of, I guess we might think of them as the first generation of AI tools, where they're maybe specialized versions of ChatGPT. Maybe they've curated some knowledge bases that other folks that the publicly available models don't make readily available.
Yeah.
But the practitioner is still entering a prompt. They're describing a patient, and they're making use of the tool that way. You have exploded the patient context to make something truly revolutionary. Tell a little bit about that.
Well, we sure think so. So for us, it starts with, again, kind of doing what we did at LifeOmic, only better, which is creating an ultra secure cloud repository for each patient. And then being able to ingest everything from the classical electronic medical record, blood test, imaging studies, unstructured notes, all of that information, but then combining it with a true 30x whole genome sequence and a microbiome sequence. We're in the process of adding proteomics, transcriptomics, whole genome methylation, all of these big data sets, but then passing them through a very sophisticated AI layer that is really an orchestration layer with a number of leading LLMs under the covers. That serve as kind of a committee. And so we force them to be grounded in truth by, first integrating an API from a company called Scite that gives us access to something crazy like 100 million academic papers from all the top journals. But also forcing them to ground their reasoning using publicly available curated data sets like ClinVar and Mondo that are maintained by the NIH and leading universities. And then kind of building that AI colleague that I described these many years ago. And then the primary interface is kind of inspired by my experience in flying high-performance aircraft, where these aircraft all have a visual representation of the plane called a synoptic view. Mm-hmm. And so it shows in real time the operation of different systems, hydraulics and fuel and engine and so on. And quickly draws your eye to points of problem. And so we've taken that ethos and we've built a pretty revolutionary interface. It starts with uploading a couple of pictures of a patient. We create a 3D wireframe of that patient's full body that gives kind of a gestalt impression to a clinician. And then kind of extending that systems metaphor, what we've done is define 15 different dimensions of health, ranging from metabolic to cardiovascular, neurocognitive, and on down the line. And then the AI layer takes all available information and infers kind of a green, yellow, red status for each one. And then the physician, the clinician, is able to drill down to further examine a particular dimension to see the diagnoses, the genetic findings, the microbiome findings, the biomarkers associated with that dimension, and always with the AI surfacing relevant observations.
Wow. It reminds me a bit of in our early days. Our first work with AI was with machine vision in, I don't know, it was probably 2014 or something, maybe earlier, with Photo Finder, digital mole screening.
Sure.
And you'll remember how sticky that was for patients to know that the surface of their skin had been cataloged in this way. And then next year I'll come in and it'll say that mole on your shoulder changed shape since last year.
Or color or
exactly.
texture.
And this is that for everything. And it makes me think about how the patient experience is going to be so different starting this year.
It absolutely is. It's kind of mind-blowing. Because we take this same interface, and one of the cool things we can do with AI is, depending upon who's using it, we can instantiate a different version of the AI. So the AI talking to a clinician, we've even kind of made human-like. We call her Lumina. She knows about functional medicine. She learns the practices of the physician. We're going to be voice enabling her over the course of the next year. But she's that incarnation of that AI colleague for the clinician. We have another version that we instantiate when it's a patient logging in. And so that version acts as kind of a well-trained nurse.
It speaks in a way that a consumer can actually understand it and take steps. So when you were trying to feed the brain of Lumina and you were looking at functional medicine, what was your source of information that you exposed Lumina to?
Well, there's some great kind of functional medicine training materials available out there that talk about the antecedents and triggers and the timeline and all of that sort of stuff. So we set Lumina a task of going out and researching that and then adding to her store kind of the principles of functional medicine that serve as part of her core knowledge.
Go ahead.
I was saying that's really exciting. And then when you move over to the various roles within a practice, you look at that practice's decision-making capabilities of the person who's interacting with it, so that the tool provides and the software provides that those limitations, those boundaries, right? So people stay within the scope of practice. Tell us more about what that team approach looks like and how you've been able to, your vision for supporting practices long-term.
Well, I mean, sometimes I feel like I'm in a sci-fi movie. One thing that we did was research kind of theory of mind. So we all have some internal model that tells us who we are. You know, I know inside I have this model of who Don Brown is. What he knows, what his values are, what his interests are, and so on. What his dreams are, what his objectives are. And so we use that theory of mind to give Lumina, in the first case, her own personality, her own model of herself. And then furthermore, human beings, we create models of each other. We over time developed models about what Tom is interested in, what Tom is like, what motivates Tom. And so Lumina develops that sort of model of the clinicians that she deals with, what their preferences are, what their styles are. Exactly.
Okay, fantastic. So when I log into the system and I'm using it, it represents my thinking and
Yes.
Wow.
So it's like a good colleague who learns your work style. And then we've complemented this with, we're in the process of building a whole string of other personas, a physical therapist, a strength trainer, a dietitian.
Right?
Yes. Okay. We've got about 12 or so that we're building. And so ultimately we would like to give a practice kind of this super team of AI personas, and as I say, speech enabling them so that a physician can assign, say, a 65-year-old woman who is kind of frail, verging on sarcopenia and osteoporosis, can assign her a program to increase her muscle mass, her bone density, centered around protein intake, resistance training, peptides, whatever the physician's preference might be.
One of the things that occurs to me is the shift that this represents for a patient in particular around understanding their health data asset.
Yeah.
Right now you invest in a lab test, it's a PDF report, it gets lost in a folder in a EHR somewhere, and maybe it is referenced again after that next visit, but probably not.
Right.
And now with the technology that you've created with Bioscope, I, as a patient, in collaboration with my practitioner, can think strategically about how I want to maintain my digital health data asset.
Yes.
So that it produces the smartest insights in the context of my particular health objectives.
And that's such an important point, because a lot of people get confused and want to compare us to static reports.
Right.
And those are fine, but unfortunately, they're often kind of one and done. Whereas what we're doing is, every time the clinician interacts with the patient, their entire care is informed by all of that information and reinterpreted every time in light of the latest findings, the latest medicine and science.
So let's think about what this means in terms of the membership-based practice. So this is such an interesting time where in the land of longevity medicine, there's this just exploding imbalance of supply and demand.
Yeah.
And there's a tsunami of patients that are now interested in taking control of the future of their health in a way that people never have been before, catalyzed in large part by the potential of AI that all of us can see to generate new insights that can shape our futures. And I start to think about how this is an obvious subscription product. So if you're a practice that has observed that investor interest gravitates towards recurring revenue subscription-based practices, but you've been sort of teetering on the fence of how do I do it? How do I convince someone who's used to sort of paying as they go to be a member of a practice?
Right.
It strikes me that this is maybe the single most compelling reason I've ever seen for a patient to decide, I want to become a member of a practice, and the single easiest and most turnkey, low investment way for a practice to create that argument. And it's the only way. This is a subscription product.
Right.
Yeah. You don't just use it and then walk away from it.
No.
Yeah. It's how do you envision that? I mean, it's in my mind, this is going to give birth to a new type of membership. And I'm kind of curious on your thoughts on this too.
Absolutely. And I think too, if you think about where these programs and membership-based practices, start to fall apart a little bit, it's between the visits. And it seems like with this type of, capability that there's constant communication that's a reflection of the care team that you normally work with. It's interacting with the member as they're interacting with their data. And I think that it's going to be exciting to see how members respond to this and how they talk to other people in their community about it. Because I think with the the J curve that's occurring with all of the direct-to-consumer labs and your ability to order your own labs and imaging and all of these other components, without having a single place to kind of have a medical home for these items, you're really not getting a full picture of yourself, and your clinicians not getting a full picture of what you're up to when you leave the office.
No, and this information is just outstripping the ability of any single human being to be able to process it.
Yeah.
But as valuable as it is to assemble all these big data sets, it really comes down to making them actionable.
100%.
Right? So, if we collect all this information and the patient doesn't do anything about it, it's kind of a useless exercise.
Right.
And so that's what we're really focused on doing, helping the clinician devise plans that are very tailored to the individual patient, and then using the interface, these AI personas to help the patient execute. As a father, I've got my dad's sayings, and one of them is the most powerful force in the universe isn't love, it isn't gravity, it's compound interest. It's those little things that we do every day that, applied consistently over time, end up yielding enormous results.
So let's wrap ourselves up. What do people do? People are going to be hearing this saying, how the heck do I get my hands on this? What's the best thing for folks to do who are interested?
Well, right now we've got a program for docs where they can go to Bioscope.ai, and there's a try it on yourself program where they can experience it. And then the next step for us, we're going to be creating a sandbox with some artificial patients where they can go and actually play. But then we do have practices actively signing up and rolling out on patients right now.
Right. Wonderful. Wonderful. Well, Bioscope.ai, this was as exciting as I had a hunch it would be. Don Brown, thank you so much.
My pleasure.
Thank you.
Your patients generate thousands of data points: blood work, imaging, genomics, microbiome. Bioscope.ai brings it all together. 15 dimensions of health, one intelligent view, an AI colleague that surfaces what matters, grounded in peer-reviewed evidence, not guesswork. Bioscope.ai, AI-powered precision health.